Dr. Paul Bergamo from Neurology Education. I'm here with Dr. Brandon Brock. Hey Brandon, how you going?
That's going good, man.
Excellent. Now last night was a bit of a different experience. It's something we didn't actually realise, honestly we didn't. We had a little backyard party for you down the streets of Sydney. The Sydney Mardi Gras was on last night for those who aren't aware overseas.
Yeah.
Is that something you've experienced before?
Well, we've experienced Mardi Gras a lot of times, but it was definitely different here, that's for sure. All different kinds of people out, lots of interesting activity. That's about the best I can say.
Yeah,
but we had a good time with friends, though. That's the most important thing.
We had a nice dinner after with some quality night. Now, I reckon there's something to think about from when you lectured yesterday, and I know Neurology Education's mantra, our mission statement is to take experts like yourself, bring you across here and update chiropractors in the latest clinical neurosciences and take the evidence and put it into practice. And I reckon 3 or 4 years ago when you came here and lectured in Australia, it's been a different tone to what you were doing yesterday and going forward, which probably reflects years of now you refining all your work and your lecturing and teaching to try and take those nuggets and put into practices. Does that resonate with you?
I think a lot of it has to do with more clinical experience, so you can really put that into the lecture. So a slide's not just a slide anymore. A slide represents things that you have done, experiences that you've had, whether they be whether they've been a winner or a loser, I guess you could say. And then, really we've realized that the traditional educational model has kind of failed. And that is just reading through slides and not going through what things mean clinically and making people work through scenarios that may make them a better clinician and that they can use in their practice. And if we don't do that, it doesn't seem to work. It's just more and more and more academic education that they don't know how to integrate into what they're doing.
Yep. That's right.
And so I think that, over the years I've learned that, hopefully a little bit.
Well, I think there's definitely, that sort of refinement of teaching, and I suppose at the end of the day, we want, for Monday morning practice, that's the key part, what we can take. And it's not like it's going to be overnight.
No.
It's got to be tested and used, and like I said yesterday, some things will work well, and some things won't, but then you build that experience. Can you talk a bit about that? With those sort of interventions, and then you start to realise, hey, this sort of patient's going to respond better to this sort of process. Is that what you think?
You get a foundation.
Yep.
And then that foundation turns into kind of what you build on. And the foundation obviously varies a little bit. I mean, you may have a group of people that came up with a hypothesis that turned into a theory that was proven, right, in the lab.
Yep.
But then you get into a real life situation where the patient has multiple dynamic situations going on with their health. It may not just be one thing that's linear. So then you have to take that foundational information and you have to renovate it a little bit. You have to put your art form into it, and that's what takes a little while to learn. And so trying to teach people to think that way in an artistic fashion where they are bringing all that information together and then they learn how to change things based upon what they're seeing and they've got a foundation laid on, that's a hard thing to do. It's really, this is probably the most difficult material in the world to teach. Everything else is, in the world of medicine, usually pretty linear.
Right. Yes.
This is not.
Autonomic nervous system specifically.
No.
Yeah. Goes everywhere.
Well,
Jumps on different spots as inputs, outputs, networks, everything.
And we've got to talk about pretty much the whole nervous system to kind of make this lecture make sense. Otherwise, we're just drawing ganglia and doing other stuff that, to be quite honest with you, you could just read in a book at home.
Yeah, understand. Just a quick snapshot about today. What's coming for delegates who are here, and also a bit about the live workshops tomorrow. Thoughts on that as well?
Today we're going to try to finish getting through that brainstem integration, talk about the sympathetics, get into the brainstem and the cortex a little bit, and then really kind of focus the end of the day on conditions. And I picked out POTS as a condition. It's a good representation of dysautonomia, and then discussing how to kind of diagnose that appropriately. And then really, I think when we do that, we'll have a fairly good foundation to get down to the nitty-gritty tomorrow.
Yep, excellent. And tomorrow, what's your anticipation for tomorrow? We've got, just to explain, we've got 7 live cases, 7 patients, very complicated cases that have travelled in as far as New Zealand that we'll be spending approximately about an hour with. There'll be initial assessments with the referring practitioner, or initial component with the referring practitioner. Then Dr. Brock will go through an assessment procedure with the patient. Complicated cases and stuff, I suppose. What's your thoughts with that? It's going to be really fascinating learning. I know that from that perspective.
Well, these are always difficult. Again, sometimes you come up with great things, and sometimes the treating doctor that comes in has a better idea than you do, and that's okay. But it's really nice to have a quorum and a group of people have their treating doctor here so that you can just give some advice.
Yes.
and then do what you can to maybe guide or direct or help or anything for these people who are struggling. That's the most important thing. That's the reason why we do any of this. It's not, otherwise, it's just we're here for our own academic entertainment, which is it gets expensive and old after a while if you're not doing it for the right reasons, and that's just to help people.
And look, the reality is these cases are, we've got a lady as old as 60 who's been through a lot of dysautonomic type problems. We've got a boy who's 15 who's struggling at school. We've got all that and everything else in between. So for whatever reason, the systems haven't got them to the point where they're at a level where they're functioning normally, if we can say that. So having these abilities to add an extra layer to the management to try and help them move forward is really the goal and agenda of tomorrow.
Yeah, get them to their optimum capacity. Some people, that's different for everybody. I mean, you may not be able to get that person back to whatever normal is, but you just want to get them functioning good enough to where they can do the things that they want to do in their life. If you can do that, you've really made a major achievement for that person. So, I mean, I think that's kind of what our goal is, to get ready to just be able to listen on Monday, and then on Monday get ready to work together to help some other people, and then create a connective network to where there can be continued collaboration so that those people can get better. I think if we do that, the seminar will be beyond successful.
Fantastic. There are a few opportunities left for tomorrow for the Monday workshop in Sydney, the Sydney Ridges, here in Surrey Hills. Next week we have a full program with paediatrics as our content topic for Saturday, Sunday. And then on Monday we have another 7 live cases, principally paediatric in origin, that we're going to be doing next week. Just a quick thought on next weekend.
You know, just going to try to recoup, revamp during the week, get a little bit of Australia in, kind of relax a little bit, make sure everything's put together for next weekend, and then help some kids.
Fantastic. Excellent. So if you'd like to register, please go to the link below at Neurologic Education. There's the landing page there for the seminar series for tomorrow, as well as next weekend. And I think we better get Brandon on stage as everyone's starting to get on here. Thanks, Brandon.
Time to go, buddy.
Time to go. Good job. Cheers.